Hi, my name is Robert Johnson. I am a student with Nightingale College. The reason why I'm here, I'm going to be performing a video of drawing up insulin. First things first, I am wearing my ID. I am wearing my full uniform, scrubs, right? Okay. And I'm sitting to make sure that I'm seen on camera. I do have my patient here, but before I even get to the patient's room, I want to just go over a few things. First things first, I'm going to wash my hands because I just got to the facility. Always wash your hands for infection control, right? Bringing outside germs to the inside. Um, as I said, we're going to be giving drawing up insulin. It's going to be two different types of insulin. The first one is going to be 4 units of the regular insulin. This is the fast acting, right? The second one is going to be 8 units of the NPH and making it a total of 12 units in one syringe, right? So that the patient would only receive one injection for comfort, right? So first things first, we're going to go ahead and compare both of these insulins, both of these medications with the doctor's order. Compare that to the doctor's order. Now we're going to also compare it with the electronic health records, right? We're going to compare it there. Doctor's order with the electronic health records, comparing those two together, doctor's orders, electronic health records, right? Everything looks good there. And what we're looking for is we're doing the 6 checks, right? Making sure it's the 6 rights. It's going to be the right patient. It's going to be the right medication, the right dose, the right route, the right time, and the right documentation. The route for this type of medication is going to be subcutaneous injection, right, of insulin, right? So those checks are done. Now I will go into the patient's room. I will pull the curtain. Let's pull the curtain there, right? Just pull the curtain there or close the door, whatever. And I'll wash my hands. I'll go over to Mr. Jones. Hello, Mr. Jones. My name is Robert. I'm a student with Nightingale College. And the reason why I'm here is because you have a doctor's order to receive insulin every morning, 30 minutes before your breakfast. And yeah, I'm going to make sure that I'm here to give that. When I'm preparing, first things first though, since I already washed my hands, I am going to just check your ID if that's okay. So I'm going to check his wristband and get 2 verifications of his ID. So it's Walter Jones is your full name, and your birthday is March. Can you tell me your birthday? Give me your full name and your birthday. So Walter Jones, thank you. Birthday is March 10th, 1955. Thank you, Mr. Jones. That's verified. Also, since I'm here, I'm just going to do another check the medication, excuse me, against the MAR. Check the medication against the MAR and making sure that everything is good there. That's good. The nurse will be coming in here soon to also verify the medication and the MAR, the insulin and the MAR, and also what I draw up. But Mr. Jones, before we begin, let me just go ahead and ask, do you have any type of allergies at all? Seasonal allergies, allergic to any medications, or are you allergic to any foods? No? Okay, thank you very much, Mr. Jones. Okay, we verified that. Also, just FYI, we did check Mr. Jones' glucose level, and his glucose level is at 155. So we will be giving him insulin. We also went ahead and checked Mr. Jones' other medications because, for example, there could be a conflict. For example, Mr. Jones, making sure if a patient is taking beta blockers or Klonopin, that could actually mask the signs and symptoms of hypoglycemia. So it's good that we check for the medication as a safety net, but also check Mr. Jones' glucose level and it's at 155. So we will be giving the insulin for that according to the doctor's order. So Mr. Jones, just FYI, when we do give you the shot, you're gonna feel like a little small burn, kind of like a little tiny little bite or a burn, or it's going to be a little poke. Yeah, it's going to feel like a little poke, right? So let me go ahead and go over this medication. The regular is going to be the fast-acting one, right? This one's going to be in your system not too long. The peak time for this one is going to be between 2 to 4 hours. This will be metabolized by your liver, your kidney, your spleen, as well as your muscles. It's going to draw the sugar from your blood and into your cells, okay? The side effects of this can be hypoglycemia as well as hypokalemia, meaning that it can affect your potassium levels, could actually drop your potassium levels, right? Um, the adverse reaction from this also is hypersensitivity, meaning that it's like any form of anaphylactic reaction, like if any type of allergic reaction, please let us know. Meaning that if you start to feel like your heart is pounding fast, or if your lips are getting numb, please let us know. Okay. All right. You have any questions about the regular insulin? Nope. Okay, gotcha. The other one that we're going to be mixing with it, as I said, because you're going to be getting 2 insulins, but 1 injection. Okay, we're going to mix these together. The other one is going to be NPH. This is the intermediate one. It will be in your system a lot longer throughout the day. The peak time for this one is between 2 to 8 hours, right? So that will be in your system that long, a lot longer. Also, the same side effects on that as far as the hypoglycemia and hypokalemia, but also this one could actually cause you to feel to actually retain water right into your system. So let us know if you feel any type of reaction from that as well. Okay. All right. You have any questions about any of these insulins? No. All right. So the nurse is here. The nurse is here. She's here. She's also checking with me as we're checking the 6 rights again. We're both verifying that this is the 6 rights, the right medication, the right dose. I'm going to do hand hygiene again. This time I'm going to put on my gloves. And I did bring in 2 alcohol wipes. Right, I got my gloves on, or almost on. Right, 2 alcohol wipes. The first one, I am going to, actually before I even put the first one on, I'm going to first prep the insulin by rolling it in my hands as I'm mixing it slothfully. Not too rough. Don't want to shake it. Don't want to get any type of bubbles in there. Right? So that was for the NPH, and then also for the regular, same thing. I verified when these came out of the refrigerator, because we're going to be giving these at room temperature. But I verified that these are not expired medications. I checked the date for both of those. So these are good to go. Not expired. They're still in good standing. I do have, as I said, 2 alcohol wipes. We're going to wipe one there around the top. Let that air dry. And we're going to wipe the second one around the top. Let that air dry. The first one, what we're going to do is we are going to inject air into the NPH first. We are going to, with the cap still on, we're going to put 8 units of air into the first one, into the first bottle. 8 units of air. Okay, let the nurse verify. She's just verifying that there's 8 units in here. Right, we're going to take the top off. Okay, with my non-dominant hand, I am going to hold the bottle still as I place the syringe into the bottle. Okay, 8 units. Now, I am not going to tilt this bottle. It's important that the syringe at this moment does not come in contact, or the needle does not come in contact with the solution. I'm just only putting air in, right? So the air is put in there. I'm going to pull that out. Now on this one, the next one for the regular, we are going to put in 4 units of air. 4 units of air. There you go. 4 units of air right there. Okay. The RN is here. She verified that there's 4 units of air. I'm going to put that into the regular bottle. Right? We're going to put that in there. Make sure we don't bend the needle. I'm going to place that there. 4 units of air is in. Now, this time, I am actually going to be pulling and burning the bottle. And now from here, I will draw up 4 units of insulin from the regular. All right, so 4 units. Let's see where the 5 is at. And there we are. Let's make sure I'm at the right spot. Okay, It is 4 units. All right. And we're going to let the nurse verify. All right. She verified that there's 4 units. Nurse is verified. Right. If there's any air, we're just going to tap. There's no air bubbles in that one, which is good. The next one, for the MPH, we are going to now draw up. Oh, my battery. Please tell me it's still recording. Good. All right. So for the MPH, we're going to draw up 8 units of MPH, making it a total of 12. Right? We're going to turn it upside down, and we are going to draw up the additional 8 units, making it 12. A total of 12. Let's get to 10 and 12. There we are. There's 12 units. And I'm going to let the nurse verify. The nurse double check. She's comparing it to the MAR. She checked. Everything looks good. Okay, good. Let me put that up to the camera. There's a total of 12 units. There's no air bubble. Oops, sorry. 12 units there. There's no air bubble. And as I'm helping the patient get prepped up to receive this, I am going to put the cap on it. We're going to use the one-hand scoop. And we're going to go there. There we are. I'm going to put this back on. Okay. And that's it for now as I'm prepping the patient. I'll see you on the next video. All right, thank you.